Was born and raised in Orlando. Representative Anna B. Eskamani is the daughter of working class immigrants elected to serve District 47 in the Florida House. Authentic, vocal, and effective, she is a champion for the LGBTQ equality, the environment, affordable housing, increased access to healthcare and public education. Just a side note, I first heard of you during the pandemic. I really got into you during then. Um, because of you, I was paying people's rent with no money, but I said, what would Anna do? So without further ado, Representative Anna Eskamani, everyone.
Aw, well, thank you so much, everyone. Thank you, Charles, for those sweet words. It's probably the best introduction I've ever had. And so I deeply appreciate you. And it's great to see many familiar faces. Karen, always a pleasure to share space with you as well. And I see lots of constituents and folks too who I don't know. So it's great to be here. And thanks so much for the invitation. I'm so sorry to be that girl that's like, I gotta go, but I obviously we're in the, GOTV, ballots have dropped. I'm trying to help multiple state candidates alongside Charlie and Val. And so I appreciate y'all giving me the grace to hop in and say hello and take a few questions before I have to hop to my next call. But if those don't know me, again, my name is Anna V. Eskamani. My pronouns are she, her, hers, and I'm super honored to serve as a state house representative for District 47, soon to be 42, with the redistricting. Much like Karen's district, everything has changed. And so those don't know, I currently cover parts of the city of Orlando, Winter Park, Belle Isle, Edgewood. Our new district will include Maitland, Edenville. We lose College Park and we lose parts of Cimarron, but we gain the historic town of Edenville and the city of Maitland. And I flipped our seat alongside my amazing team in 2018. We kept it in 2020, and we're up against basically a MAGA candidate, and are very committed to keeping this seat and winning big on November 8th. So, of course, the focus of y'all's space is Medicare for All, which clearly carries more weight at a federal level, but of course at a state level, we have a lot of work to do, and not only echoing support, but of course trying to, at the very minimum, expand Medicaid in our state to close the coverage gap. I was asked to speak about my support for Medicare for All and just for, a public health option. The state version of that has been filed in the past. Candidly, I'm not sure who's going to file it this year, but I'm sure someone will. Maybe Anthony Nieves, as he comes into the House, might be a good sponsor for it. We'll see. But, my foundation always has been that healthcare is a human right. And like Karen mentioned in her personal story, my family navigated healthcare crises early on when I was a kid. My mom was diagnosed with cancer when I was about 9 years old. We grew up in Orlando as an immigrant family. I'm first generation. My parents came from different parts of Iran, and I would be remiss if I didn't acknowledge the protests happening in Iran right now and the calls by the women of Iran for self-determination. Their calls for Zan, Zendagi, Azadi, which means women, life, freedom. So as we fight for women, life, freedom here in Florida, I have family and loved ones in Iran that are doing the same. And so want to always express my solidarity for those in Iran demanding better from their community, from their government. And so with that said, as my parents navigated my mom's cancer diagnosis, finances were always such a barrier for us. My parents carried a lot of debt as I grew up. My mom worked at Kmart. My dad actually was an engineer on the weekends, but worked as a customer service representative at Walt Disney World on the weekends because we struggled to make ends meet. Many, many nights were spent at Kmart, at the Little Caesars there, and waiting for those blue light specials and just really helping my mom pack up the store. She was a manager of, some of the departments, and at the end of her career. And so I know what hard work is like, because that's the only life I know, is one of hard work. And despite how hard my family worked, we never got a fair shot, which is the situation for too many Americans. And indeed, my mom fought cancer really, really courageously, but didn't win that fight. She passed away when I was 13 years old. I held her hand as she passed away at what was then Florida Hospital downtown campus, now Advent Health. And so, my dad actually was only able to pay off our medical debt and the debt from his college, because at the same time all this was happening, we were moving to a new home, and during the 2004 like housing boom, it was the first time that me and my twin sister would have our own room. We shared rooms, so we were 13 years old. And my dad took out like an extra part of the loan from that house was used to pay off this debt and the medical bills that we had collected, because though we had private insurance from my dad's employer, still didn't cover everything. And my parents tried every experimental option you could think of, which also comes with travel costs, other types of costs that are not even, considered covered. And so having that experience growing up, knowing what it's like when your access to healthcare is determined by what coverage you have, and also just growing up understanding how corrupt insurance companies are, how much overhead cost there is. I mean, I'm a big advocate too when it comes to reform with pharmacy billing managers at a state level, because they have no transparency, and oftentimes they play the role as a middleman, cutting off profits, while the rest of us pay more for essential medications. It's good policy. And at the same time, it is bipartisan. I mean, I know so many Democrats are scared to talk about it because they don't want backlash from the insurance industry. But at the end of the day, like universal healthcare, conversations around healthcare being a human right and the challenges of whether it's pre-existing conditions or medical bankruptcy. I mean, these transcend party lines. And so we have to talk about it. We have to be brave in our conversations. And again, as a state house rep, I know I'm not necessarily, in it every single day compared to, Maxwell and Hedra Frost will be, but we do play a role at a state level to be advocates and, of course, to support what we can at a state level. So with that said, I did want to just also speak to so many other issues that are on the ballot this year. Everyone knows how passionate I am about reproductive rights. I worked at Planned Parenthood for 6.5 years before I ran for office. My Planned Parenthood story is one of being a patient because my mom passed away when I was a kid. I didn't have anyone to talk to when it came to making healthy decisions about relationships, about consent, about prevention, that I walked into a Planned Parenthood health center when I was 18 years old and left the method of contraception that was right for me. And as I held that pill pack in my hand, I not only felt a deep sense of gratitude to have access to contraception, but I felt this weight of so many fighters who came before me who did so much to make sure that at that moment as an 18-year-old, I could have self-determination. I could make a personal decision about when I wanted to become a parent. And I realized too that experience was not one that every person, let alone every young girl, has in our state. And it's what committed me when I was at UCF to get really involved, not just with campus organizing, the college Democrats, but eventually volunteering as a health center escort at Planned Parenthood, and eventually being hired there, as I mentioned, from 2012 to 2018. So really grateful for the space. We have a lot of issues to fight for, from healthcare to the environment and climate change to housing affordability, to closing corporate tax loopholes and ending mass incarceration. And so always grateful to share space. Happy to take a few questions, and I gotta hop off and get to my next call. So thanks again for having me.
Okay, does anybody have any quick questions for Representative Eskamani? Going once. All right, Stefan.
I think Stefan, yeah, good to see you again.
Yes, thank you so much for joining us tonight and speaking to us. Thank you. I mean, it's really encouraging, of course, to hear about all of what you just shared and your support for Medicare for all. At the same time, just about the state level. So, for example, there was the legislation, the Healthy Florida Act, which was introduced by Senator Torres and also co-sponsored by Carlos Gilliam-Smith when it was introduced back in 2019. So, such a legislation, if it was being introduced again next year, is that something you could see yourself co-sponsoring?
Yeah, absolutely. As I mentioned, I wasn't sure if it was sponsored in the House last session because I don't think it was. So thank you for reaffirming that, because I couldn't remember. And so, yeah, I mean, 2018 was my first session. And so, I'm hopeful that we'll be able to elect more progressive Democrats who are committed to this. And as I mentioned, I think Anthony Aves could be a really good sponsor as someone who is sure to win his general election, because unfortunately we only get 7 bill slots as state House representatives. State senators get unlimited bill slots, and so it's a little bit easier for the Senate Dems to be able to find people for every bill. We're very limited, and our 7 gets crowded pretty fast. But as new freshmen come in, I'm very hopeful that we'll be able to get it filed this session, and look forward to co-sponsoring it.
Great. Thank you so much.
Thank you.
Okay, Dr. Leo.
Yes, hi. I'm curious about a little over half of Democrats have supported this bill. I'm curious what's your opinion on what's holding back the other half?
Well, excellent question. And my gut reaction is just corporate influence, candidly. I don't know what else would be the barrier. Like from a messaging perspective, I mean, I have not looked at polling recently, and polling is always a coin toss anyways. But my assumption is that it's just their corporate donors who don't want them to. As we've seen in many other policy decisions, whether it's Manchin or Sinema, it often seems like it's corporate influence that pushes them to make policy decisions that benefit the bottom line and not their constituents. And, I don't take money from those actors, so I operate really independently, whether it's insurance or the theme parks or the sugar industry or FPL, private prisons. I don't take money from any of them. So I'm not worried about that effect, if you will. And there's also the dynamic of people who, they might not take money from the industry, but they don't want to piss off the industry, if you will. It's because they operate in a place of fear of backlash. And so that also can keep them out of the conversation. And again, we should not operate in fear. Like we're elected to make tough decisions or to and to support important policy, whether there's special interests involved or not. But that's just not the norm in the political process. And so that's my gut reaction. Again, I'm not in Congress. I don't know what the other vibes are. But I assume, just based on my state experience, that's probably very similar to when Democrats vote with FPL or vote with sugar, is that it's not because they agree with the policy, it's because they just take their money and feel like it's the easy way out.
Yeah, we have the best democracy money can buy, right?
Unfortunately, that's very true. Yeah. And it absolutely corrupts the process to its core.
Thank you.
For sure.
All right. Anyone else? Going once. All right. Thank you, Representative Eskamani. Before you leave, if you wouldn't mind, can you put your info in the chat so people can get in touch with you?
Absolutely. I will do that. And
thank
I'll put
you
my
so
email
much.
there. So please reach out. I appreciate y'all. Have a great night and keep fighting.